What happens when I call 911? First, let's define emergency and non-emergency. An emergency situation is an acute medical condition, illness, or injury that poses a high risk to a person's life or health and requires immediate intervention. Someone needs help now, or could get hurt, injured, or worse if something is not done immediately. For example, a sudden onset of chest pain, uncontrolled bleeding, or signs of a stroke. We call this high priority level of response Code 3, which requires the use of lights, horns, and sirens. It's risky business, considering the dangers of driving big rigs at high speeds through traffic or other adverse conditions. When you call 911, the dispatcher will send a fire engine or truck as well as an ambulance, and perhaps, in some cases of dangerous behavior, a law enforcement officer. A non-emergency situation is a medical condition, illness, or injury that does not pose an immediate risk to a person's life or health. However, the person may require additional medical assessment, intervention, or transportation. For example, a ground-level fall with no immediate or new signs of impairment, a minor cut with bleeding controlled, or a prearranged transport to a doctor's office. We call this level of response Code 1, no lights, sirens, or extensive numbers of vehicles and personnel. It's important to remember that for these non-emergency calls, there is no need to call 911. Simply contact your local wheelchair, stretcher, or ambulance company to arrange the appropriate type of medical transportation. Okay, let's clarify when to use 911 to request emergency services. If you think there's an emergency, don't hesitate to call 911. The 911 system is designed to send highly trained responders and specialized equipment as quickly as possible for almost any type of environmental hazard or medical emergency. However, not all situations require the use of this system. In the assisted living setting, it is imperative that someone from your staff observe and assess the patient before calling 911. Sometimes the emergency system is activated too quickly, or simply by facility protocol, when the situation could have been resolved by a quick check and a reduced level of response. That's a lot less stressful for everyone. In certain circumstances, such as a low-energy fall or scrape, checking in with the patient or his caregiver, who knows him well, may prevent an unnecessary 911 activation. It may turn out that the patient may only need help getting back into her bed or chair. If there's any doubt, the 911 or private ambulance company dispatcher will help you sort things out. We'll talk more about that later. Remember, the 911 system is designed for emergency response. Calling 911 for non-emergency situations uses critical resources that may be needed elsewhere for people experiencing truly life-threatening emergencies. So please, check with the patient, caregiver, or responsible party first, before activating the 911 system, to make sure that an emergency response is really needed. When you do call 911, the dispatcher will ask questions. 911 dispatchers are highly trained to triage or sort calls so they can send the right level of response. After you identify yourself and your location, the dispatcher will ask you a series of questions about the situation so that you can provide them the most relevant patient information. Then they decide who to send and, in turn, relay that information to the responding crews. It's best if you let the dispatcher lead the telephone conversation so she can get the facts she needs as fast as possible. Similarly, when requesting a non-emergency stretcher transport through a private ambulance company, you will also be asked questions regarding the current status and needs of the person you are calling about. Please be patient and understand that the questions are asked in the best interest of your resident. There have been many instances of non-emergency transport requests being turned over to the 911 system. This occurs when callers answer the non-emergency dispatcher's questions in such a way that leads the dispatcher to believe there is a true emergency and consequently needs to activate the 911 system. All dispatchers are trained to listen for key words or phrases to determine whether there is a potentially harmful medical or physical issue happening right now with the patient. Common examples of these questions are, is the patient short of breath? Or does the patient know where he is? However, some patients have chronic medical conditions that may sound like immediate threats, such as abnormal breathing from CHF or disorientation due to dementia. So when you call to schedule a non-emergency transport, make sure that you inform the dispatcher that these seemingly urgent conditions are not a new condition, but is the normal baseline for that resident. Explaining that this condition is normal for the patient will help the dispatcher determine the resident's actual needs and the real reason for the call. Think to yourself, what is different today? And clearly specify the current circumstances and needs to prevent a non-emergency transport request from being upgraded to a 911 emergency call. Here's what your fire and EMS responders need from you on the scene. As displayed in this video, arriving emergency personnel need accurate and timely information about why they've been called. Make sure that a member of your staff greets the incoming crews upon their arrival, briefly describes the situation, and directs them to the resident. Your staff person standing by with the patient should also be able to summarize the reason that 911 was called and provide any additional details or changes that may have occurred since the initial call was made. Please assemble all relevant patient information and documentation, such as advance directives, medications, and medical history, and provide copies to the crew who will be transporting the patient. Make sure that you mention any DNR orders or other immediate directives to the crews, who may not have time to read them if they are busy providing care. They don't know the resident as well as you do, and will be grateful for any information that you share that can help resolve the emergency. In summary, so that we can work together as a patient-focused and integrated team, please remember, not all care and transport situations require the activation of the 911 system. 911 should be used only for life-threatening emergencies. If emergency resources are tied up responding to a non-emergency call, they may not be available to help those experiencing a true emergency. When you do call, have the resident's caregiver assess the patient both physically and mentally to help determine and describe what is happening now. Listen to, understand, and answer the questions that the 911 or ambulance company dispatchers ask, and provide the most relevant information possible.
For example, if the resident is suspected of exposure to or has been diagnosed with a communicable disease, the crews need to know that before they arrive so they can don the appropriate personal protective equipment.
Have an associate assemble advance directives, post forms, or power of attorney information, and make copies for the transporting agency. Greet responders with a precise summary of what is happening now, and guide them to the resident. It may seem that the medics are asking too many questions, but they may not have gotten all the medical details from the dispatcher before arrival. Please bear that in mind and answer to the best of your ability. That will ensure the best possible treatment for your resident, both at your facility and en route to the destination. Thank you for all the work you do. We hope that this video helps us all understand each other's needs and procedures so we can work together toward our common goal of great patient care.
If you have any questions, please contact the agencies listed here and in the supplemental brochure.